I'm going to call to order this work session meeting for November 10th, 2021, and I apologize if my audio is a little scrambled or garbled. The first item on our agenda is a discussion with Sam Crowe regarding advanced correctional healthcare contracts. Good morning, Mr. Crowe.
Good morning, commissioners. Please excuse me. I'm fighting off a cold, so I'm a little froggy. ACH is our current provider for mental health and medical. And what I would like to do is expand basically to renewal option number 4 on the sheet, and that have an RN as our site manager for 40 hours a week on site. And then that would also have an LPN on site 104 hours a week. So it'd be 144 hours compared to what we currently have at 114 hours. And I think I'd mentioned before that having an RN, the extra training, the administrative training that the RN has is a great resource for us. And currently our site manager is an RN. And this was very evident when she went on maternity leave. The things that she had been doing kind of disassembled, fell apart a little bit while she was on that maternity leave. So I think it's very nice to have that RN with the extra training, the administrative training to take care of our site. So that's the first part of it, increasing those nursing hours. The second part is to work on our mental health again. As you have heard me say before, the jail is the largest mental health facility in the county. And with COVID, I think that has increased the role that we've played with mental health in the jail. We see more cases of mental health and especially severe mental health in the jail. So I think it's very important that we continue to grow with our mental health and provide these services to the inmates, to the people that we have here. And with that additional 20 hours that I would like to see, I've talked with our current mental health providers, and we would be able to do some specific groups like moral recognition therapy or MRT within the jail population. We would be able to do some specific groups for our New Beginnings therapeutic block, specifically with anger management. And I think that's very important to help those people as well. And then a couple other things is mental health education for our staff. Our staff receive very little training in mental health. And generally that's done when they first enter the facility as a new officer. So we would increase that level of training with our new staff, and then we would do more training with current staff and get them to where they're a little bit more comfortable in dealing with people with mental health recognition, and just things like that. So I think that additional 20 hours would be very beneficial to the jail, to the inmates in the jail, to the staff of the jail. And that's what I wanted to discuss with you today. And I'm trying to be quick. So I know you have a
Yeah, we appreciate that. Thank you so much. Let's see if there are comments and questions. Commissioner Jones?
I'd like to thank you for bringing this forward. It sounds like a really good idea to me, and mental health in jails is a major problem that really needs to be addressed.
And with that, I think we probably have one of the best mental health programs in the state, but I want to continue that. I want to grow that. And I want this to be the role model for the state. We have had other counties call. But again, I want to grow that and keep getting better and better at what we're doing here and provide better services for the inmates that we have here.
Yeah, sounds good. Commissioner Giffens?
Well, yeah, first of all, I want to thank Commander Crowe because hopefully this will address issues of recidivism as well. If people have their mental health needs met, the hope is that they will not be back to see us again in the future. But I was going to ask just one simple question. You're proposing that there would be a total of 144 hours of coverage by nursing staff. So how many hours are there actually people on staff? Because I know that oftentimes there's more than one nursing staff present at a time. So is this sort of 40 hours coverage, 60 hours coverage, in terms of the number of hours anybody's on site?
We generally, right now, we're doing about 12 hours a day. So I would like to extend that to about 14 hours a day. And there are times when we have to have the nurses here at the same time, especially when we have one of our providers here, like the doctor, mental health provider, dentist. They like to have an additional nurse here to help take care of those things and to chart things and do what they have to do with medical services. So, ultimately, I think I would love to have a 24-hour-a-day program for medical, but at this time, I just don't think that's feasible. So I like to try to take small steps and see how that affects things. And if it works, we might be able to come back in a few years and ask for more. But right now, I think this would be a great step forward.
I'm just looking at the chart that you provided, and I'm trying to determine how this works with what we pay currently. What are we adding? And is this a 2022 contract?
Yes, this is a 2022 contract. So renewal option 1 and renewal option 2 would keep our nursing at the same level that it is right now at pay at 114 hours a week. But that would increase, again, in option 1 and option 2, that would increase our mental health. Option 1 would be 12 hours and option 2 would be 20 hours.
Mm-hmm.
Then option 3 and 4 would be with the RN, 40 hours a week, and LPN, 104 hours a week, mental health, 72, and then 80 hours a week.
Okay, and then the only difference then between renewal option 3 and 4 is the number of hours per week for a qualified mental health professional.
Yes.
Correct. Okay, and which option are you looking to do, 3 or 4?
I would prefer option 4. I think we get more bang for our buck with the 80 hours than we would for the 72 hours.
All right, that sounds really good. And then the council would have to, has the council approved a budget that would pay for that monthly?
They have approved a portion of it. At the time we were doing our budgets, I didn't have the exact figures. So I think we're a little short on what they've approved. So I would have to go back and ask for more. But I think they approved $1 million for 2022. So that would leave us about $54,921.50 if you would approve renewal option 4. So I would have no appropriations for that.
Great. Okay, that makes a ton more sense. Thank you so much for coming and explaining all of this. My colleagues, are we okay putting this on our agenda for next week? Yeah. Yes. Great. It sounds really good. And I think you want to be really specific with your agenda item request, Commander Crowe, and name your option.
Okay. And if you're good for, that's what I will do.
It sounds like we're really happy with this expansion of services. So
I will call and get a contract worked up and get that to our legal department. We can, and then I'll have this scheduled for next week.
Excellent. Thank you so much. I appreciate you coming in today, and we look forward to seeing you hopefully next week, or if not, soon after. Okay.
Thank you very much. Have a good day.
Thank you. Feel better.
Thank you.
All right. Next we have election board. Clerk Brown, is there anything, any new information you wish to share with us today?
I do, and I will try to be really quick. Can you guys hear me?
We sure can. Thank you. Good morning.
All righty. Good morning. It is still morning. Yes, good morning.
Yep.
I would like to thank the Board of Commissioners for the correspondence that was read into the meeting minutes from last week's election board meeting. On behalf of the board, I would like to request a written copy of that correspondence. In previous work sessions, I believe I'd adequately articulated, at least to the best of my ability, what I was requesting in layman's terms. And I want to reassure the board that I am working on a response to not only the presentation you gave before the election board, but also the newly requested information presented in your recent correspondence. Additionally, I'm sure the entire election board joins me in looking forward to the next work group meeting. In the interim, however, there has been a silver lining. Upon recognizing that my ability to articulate election central space needs in layman's terms had either not translated or not resonated, I was able to get a complimentary consultation with an Indiana architect for an assessment of our election space needs. Recently, he spent the better part of an entire business day with us. We offered him a brief and general tour of the facility. He took measurements of our existing layout and space, and I articulated our space needs. He was able to display a computer-generated rendering of our space at Election Central. There was this phenomenal software that allowed him to virtually take down the walls of the Johnson hardware space, allow us to position and reposition everything that we use in that space for election and voter registration purposes. And we also discussed what we needed and for what purpose. He then put the walls back, so to speak. Before his departure, as a layperson, I asked him to offer his professional opinion based upon his having spent the day with us and having what I felt was an amazing conceptualization and understanding of what we do and what we need. I asked him exactly how much space he thought we truly needed to do what we do. He pulled up that computer calculator over his computer generated rendering and input some numbers. His response, 12,768 square feet. In the interest of full disclosure, I had never met this person prior to his coming to Election Central for that consultation. He is not a Monroe County resident, and he has absolutely nothing vested in the outcome of the resolution of Election Central space needs. However, he does have experience working with county government agencies in Indiana, and he was able to fully grasp the circumstances in which we currently find ourselves when it comes to our space constraints and our election needs. I look forward to receiving his written summary of that report following his visit. And as one of my election board members said, I believe that will go a long way to supplementing the information that you've asked from us. And I look forward to making that available to both the election board and the Board of Commissioners at the earliest possible opportunity. And with that, I just look forward to seeing you at next week's work session.
Sounds great, Clerk Brown. Thank you so much. We appreciate that. Does any other, is there any other department head that has an item for us? So I will note again for the record that the next meeting of the working group meeting of the Election Board and the Board of Commissioners is November 17th, 4:15 p.m. That will be via Zoom, so folks can watch from the public. We are also looking forward to seeing this report and this information, and we are still waiting on the report from Mr. Turner. He had said that at a previous election board meeting a few months back that there was going to be some information sent, so we hope to get that as well. We're looking forward to seeing what this architect has done, and also Ms. Purdy, I'm sure, can forward the information and the questions that we posed at the last election board meeting. She was gracious enough to attend in our stead. If you could get that forwarded to the election board, that would be great, because we had a few questions. But let's move toward getting this resolved as soon as possible. Yeah, that would be good. All right. Anything else for the good of the order? My colleagues have other comments to make? Okay. Excellent. With that, we are going to be adjourned. Thanks, everyone.